No noble lies. You tell the truth on what the data is saying. You don't, and the same thing with the treatment and the antibodies. Part of the reason when I rolled out the antibodies, we were in the midst of a wave, okay? People like Fauci said if 50% were vaccinated, you would have no more surges. We had that. In fact, our seniors were over 90%, and yet you see admissions going up. So what do? And people were saying, well, most of these people aren't vaccinated who are being admitted. True, 100%. I wish that they had been. I think many of them probably wouldn't have been admitted. At the same time, when you're in the midst of a wave, you can vaccinate immediately. It doesn't kick in for weeks, probably 6 weeks after that. So what are you going to do to help people in the meantime? And we were seeing people who were vaccinated getting infected. We hoped that it would produce sterilizing immunity. Remember the Pfizer trial, 95% reduction. That's clearly not happening. I mean, we look around, people are getting infected. The role that vaccinated people play in spreading it, I don't know, but I can tell you, I think every state in the country had higher cases this summer than they did last summer when no one was vaccinated, so it'd be hard for me to think it's only occurring amongst a small slice. So nevertheless, we saw that, and we knew our most vulnerable people overwhelmingly were vaccinated. So what do? Well, we had an effective treatment that's been emergency use since the end of 2020. It was used on the President of the United States to help him recover from COVID. This is something that many of our hospitals were using, but it was something that almost none of these people being admitted to the hospital even knew about. Many physicians, as of last month, were still telling people, okay, go home, hope you don't get deathly ill. If you get deathly ill, then go to the hospital. There was never any interest or belief that this should be treated or even could be treated. I don't know why, but I do think that one of the reasons why this was not something that was put out there very publicly by the experts and by the powers that be in DC is because they feared that if you tell people there's an effective treatment, if you tell people COVID's a treatable illness, they feared some people would say, well, maybe I won't get vaccinated, I'll just get the treatment. And so they didn't want that message out because they feared how people would behave. And my view is, we've always said it complements. If you want to cover all your bases, do it as a complement, but you can't not tell people that this is something that's available. And so the result is, when we started doing our push, I was attacked for it, saying you're not supposed to do it. We did it, we raised awareness, which is very important, and then we expanded access. And the result has been, I think we're at, 29 straight days where the hospital census has declined, 8% reduction in the census as of this morning, ED visits, this is all tanking, and it was the right thing to do. Now you have other states where they're now following Florida's lead. I get people will write into the office here from these other states thanking me because they didn't know about this, and so they started bothering some of their doctors in these other states to be able to get this. So having the treatment is the right thing to do. I think increasingly as we see more vaccinated people test positive, again, I think most of the time it's gonna be a mild case and you're probably not gonna need this, but we are seeing some very vulnerable people who have been saved for this. And if you look at some of the places, I mean, Miami, I think it's like 60-some% of the people that have gone to our treatment site in Dade have been vaccinated. Broward is, I think, 52%. Some of the other sites, more rural areas, the majority are unvaccinated. And I'd say overall, you're looking at 40 to 45% of the people statewide that have gotten this treatment have been vaccinated who were either infected or were exposed and are in high-risk situations. So telling the truth, I think, is important, and I think that's what Dr. Ladapo understands, that you gotta tell people the truth and you gotta let them make decisions. They may not always make the decision that you want them to make, but I think that's much better than pulling the wool under their eyes. Now, we have a situation in Florida now where, in spite of this data, where we see far fewer people being admitted to the hospital, thankfully, we're seeing people kept out, we're seeing lives saved.